in the pediatric office, we usually screen for it as the kids are growing up. And it's actually pretty easy to test for. I'm going to show you. Kaylin, why don't you stand up? Pretend we're in my office. We're sitting here, listening to your heart and lungs. Then we say, okay, now I'm going to check your back. So I'm going to have you stand up. We're going to keep your knees straight, put your hands together like that, and bend over that way. And we just kind of look from behind, and you can see if there's any scoliosis going on, you're going to see a pretty big difference in either the height of the shoulders or one of the side of the rib cages sticking out, or even just a curve of the spine. Now you can get back up. Now, then we would send you for an x-ray. And depending on the curvature, often if it's just mild, traditionally, medically, we'd say, okay, we're just going to watch it. You're not bad enough for a brace or surgery yet, but sometimes chiropractors would have a different approach.
So, yeah, let's actually do an adjustment. Kaylin, if we could get you face down. Basically, what we're going to do is we're just going to feel over the spine, and hers pulls over to the right. Kaylin, take a deep breath in for me, and all the way out. There you go. There we go. Good. Now, Kaylin, if you could turn on your side towards me. And she's a pro at this. She's done this a million times.
And the one thing about this, yeah, sometimes is when the doctor says, hey, I know your child has a problem, but we don't need to do anything about it. Parents can be frustrated, and they'd rather be a little proactive. And I've actually had a lot of patients seek out chiropractic care for this type of situation and do quite well.
Most of the scoliosis cases that we have, about 80% of them are considered idiopathic, which means that they're unknown. We don't know why. But traditionally, they say that it's 2 to 6 times more prominent in females than males. There we go. Good. And then the other side. And that's it. It's very safe and effective. It's a great adjunct to keeping active, making sure that she's still playing softball, yoga, giving her some specific exercises. I also am a big fan of lasers because I have lasers in my office. And I also give them foot orthotics if in case they have one leg that's a little bit shorter than the other.
Thank you, Jennifer.
Thank you very much.
Thank you, Karen.